Despite warnings of a resurgence of COVID, Congress may not be willing to continue the fight, and the White House may face difficult choices and trade-offs in pandemic response. Adam Cancryn is a White House reporter for Politico Pro. Adam, welcome to the program.
Hi, nice to be here. Thank you.
Specifically, what is the White House asking for, and how would those funds be used?
Sure. So the White House is asking for $22.5 billion. And what that would be used for is essentially to continue the coronavirus pandemic response that we have seen now for the last couple of years. And that includes a number of things. That includes developing and distributing the COVID vaccines, developing and distributing the treatments, things like Paxlovid that you take after you have COVID to cut your risk of ending up in the hospital, and making sure that we have enough tests on hand so that if cases go up, people want to go out and test themselves, they're going to be able to find those on the shelves. There are a lot of other things that go into that. Obviously, money for campaigns to make people aware that vaccines are out there and available. But the core elements that the White House is looking for right now is funding specifically to make sure we have those core tools, vaccines, treatments, tests, going forward here for the next several months through the end of the year.
So then what's the rationale for congressional Republicans denying the funding?
Well, there's a couple things that they've said is one, they're not convinced at this point that there's a need for this funding. One of the objections is that Congress has already authorized trillions of dollars, right, for this COVID fight, and they want to see exactly how that money has been spent before they now authorize more. Other people are skeptical, now that we even need it. We're through, obviously, a lot of the big crisis points right now. Cases are still going up again, but not nearly as badly, right, as if you remember in the winter. And so there are some Republicans who say, why do we even need to be giving the government more money? We've clearly got a handle on it, and we can do that going forward. What the White House says, obviously, is that there's a lot more preparation to do, and that if you wait until we're in another crisis to allocate more money, then it's going to be far too late to do the kinds of things that would get us the tools we need immediately.
So has the administration properly accounted for the pandemic relief funding already spent?
They say that they have. They have shown us a large binder of essentially the accounting of where money has gone, what's obligated, what's left in the accounts. And the bottom line is that while there has been a lot of money laid out already, that has all been allocated to different kinds of things. And there really is a dwindling amount of cash reserves left when it comes to how do we allocate and order vaccines for the fall? How do you make sure that you have the money to pay drug developers for treatments that we may need in the summer and later on in the fall and winter? And so that's the core message, that yes, there's been a lot of money spent, but there's going to need to be more down the road if we want to be prepared for fall and winter when you tend to see a lot of those COVID surges.
So then let's talk about the options facing the administration if Congress doesn't approve the funding.
It's pretty grim. So right now, one of the things that President Biden has made a key kind of part of his federal response is this idea that if you want a vaccine, you can go out and get one. They're plentiful, they're widely available. Every American who qualifies, go out and get it right now. And to be clear, you can still do that. What they are worried about now is whether that will remain true in the fall. The government and drug companies are working on essentially updated vaccines that would better target the Omicron strain of COVID that is kind of circulating right now. And they're worried that if that development goes well, we could have these so-called next generation vaccines, but not have the money to buy enough essentially for everybody. And so what they've talked about is, in a pinch, they would have to ration those vaccines and make them available only to the people who are highest risk and not to everybody. And that would be a big step back for the federal response, a big change, I think, than something that we've gotten used to over the last year. And the same would be true with COVID treatments. Right now, there's been a big effort to make them available. If you get sick, you can go out, talk to a doctor, get prescribed Paxlovid, and pick it up from the pharmacy. That may not hold true if there's not enough money to keep those stocks up.
And has that contingency planning already started? And what's involved in gearing up for that plan?
It has. It's a lot of kind of contingency planning and figuring out, okay, if we have this much money, How do we allocate it? Is there any other way that we can kind of make that funding stretch a little bit further? One thing down the road that has been talked about is that eventually there will need to be a transition from the government paying for absolutely everything, which is unique kind of in the way that we do healthcare traditionally, to health insurance companies, private insurance taking over a lot of that kind of payment responsibility. And that would be a big shift. And the sources that I've talked to say for vaccines especially, it would take about 9 months to do that planning. So a lot of that is underway just in case. It would be really jarring, especially in terms of access for people who don't have insurance, people who are lower income. And there's a real focus on, if that does come to pass, the government wants to make sure it goes as smoothly as possible and with as much notice. So it's a lot of kind of combination of work in the immediate, trying to make sure that COVID stays under control now, and also trying to figure out what are the scenarios depending on how much money Congress is willing to give 6, 7, 8, 9 months from now.
All right, Adam. Well, we'll continue to watch this as it goes through Congress. Thank you so much for joining us.
Thank you.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.